in Pediatrics by Kaylee Cannon. Etiology, genetic causes could be Down syndrome, Fragile X syndrome, or Rett syndrome. Prenatal factors, maternal alcohol or drug use, infections and toxin exposure. Perinatal factors, hypoxia, prematurity, and birth trauma. Postnatal factors, TBI, traumatic brain injury, meningitis, and or malnutrition. Etiology is multifactorial. 30 to 40% remain idiopathic. Characteristics and common symptoms, cognitive delays, that could be slower learning and difficulty with abstract reasoning, adaptive behavior deficits, communication, social skills, and or self-care challenges, developmental delays, motor and speech milestones are achieved later, behavioral traits, limited problem solving or difficulty generalizing skills, impact on development. They can have academic achievement and social participation issues. They could require individualized instructions and supports for school. For social participation, they have the risk of isolation and difficulty with peer relationships. Adaptive functioning, they can have reduced independence in ADLs and or IADLs. Occupational identity, limited opportunities without structured supports. Functional implications could be daily living skills, dressing, feeding, and hygiene. They often require more assistance. Communication barriers, expressive or receptive language deficits. Independence, lifelong support needs vary by severity, so depending on the diagnosis. Employmental potential, structured vocational training improves the outcomes. Effect on child's occupations, their play could be affected. They could have difficulty with the rules, sequencing, and or imaginative play. They could have issues with their schoolwork. They could just do it at a slower pace, or they need individual attention, like having a teaching assistant work with them. Social participation, they could have challenges forming friendships and with teamwork assignments. Future work roles, they benefit from transition programs and supported employment. Things to consider for OT is client-centered approach. Their focus on strengths and meaningful occupations. Skill development, ADLs, communication and social interactions. Environmental modifications, visual supports, and structured routines. Family training, just make sure that their parents can reinforce the strategies you're teaching at home. Assistive technologies, communication devices, and adaptive tools. Evidence-based practice, just make sure to use the AOTA guidelines and the AJOT systemic reviews to guide your intervention. And there are my references. Thank you.